Hey everybody, it's Dr. Osborne, founder of Gluten Free Society and drpeterosborne.com, here with you today in part 2 of our 4-part series on mold-related illnesses. Today we're going to be addressing what are the symptoms of mold exposure. So let's dive in. There are a lot of different symptoms, and understand that, just like one person may have one reaction, another may have a completely different reaction. This is one of the big problems in getting a diagnosis or getting kind of a solution as to whether or not mold is playing a role in the illness, because so many people, they really have what's a kind way to put this? They have a simplistic way of thinking, and so you can't have a simplistic way of thinking when it comes to mold toxicity. Let me give you an analogy. Mold exposure can create multiple types of problems depending on the person's own unique chemistry. Just like if we gave a drug, let's say for example, we gave 1,000 people the exact same medication, we're not going to see that they all have the exact same response to that medication. Well, I want you to think of mold as a chemical, right? Mold toxins can be chemicals, and so different people may have different responses to them, and you have to keep that in mind if you're going to understand what are the symptoms of chronic mold exposure. So let's kind of go through this list here. Number 1, chronic sinusitis. This is kind of one of the least aggressive symptoms in terms of mold. Inhaling mold spores or having mold growing up in your sinuses can create swelling, can create pressure. You think of it almost like an upper respiratory infection, the way you might feel. A lot of drainage, mucus, pressure can create discomfort in the sinuses. So chronic sinusitis that is not, basically, if you throw an antibiotic at it and it's not responsive, really you should start looking for a potential for mold. Number 2, debilitating fatigue. And this is extremely common. And one of the reasons why, if we look at number 2 and number 5 together, sleep issues, many people with mold exposure, there is an actual chemical response that mold can create that shuts down your body's ability to properly go to sleep. And that, of course, is going to lead to a debilitating fatigue. If you're not sleeping effectively, you're not going to be refreshed in the morning, and you're not going to have energy. So number 2 and number 5 on this list go hand in hand. Then we have number 3, which is muscle and joint pain. Very, very common side effect of chronic mold exposure. Almost think of it like a fibromyalgic-like symptom. So if you've been diagnosed with fibromyalgia or chronic fatigue syndrome, and your doctor hasn't ruled out mold as a potential cause or contributing factor in your case, really want to go back and have that conversation with him. Number 4, immune dysfunction. And it's very common to see people with mold toxicity or mold issues be immunosuppressed, meaning their immune systems aren't very strong and they pick up every cold and flu that comes along. And a lot of times people who are exposed to mold, when they're immunosuppressed, the mold can actually make it worse. So going back to, if you haven't watched part 1 in this series where I talked about people who with autoimmune disease are chronically put on immunosuppressant medications, those are the people here we're really concerned about, because if you're taking a drug that suppresses your immune system and then you go into a moldy environment, the risks become even greater. They become even more exaggerated. So on to, I'm going to skip 5 because we covered it. Number 6, migraine headaches. Very, very common. Mold, I showed you in part 1, is a neurotoxin, can generate an autoimmune response against your nerve tissue, and migraine headache is one of the symptoms that can manifest as a result of that. Then we have severe irritability. Now, severe irritability, this is, mood swings, crankiness, that type of thing. And a lot of this comes with number 2 and number 5. When you don't feel well, when you're tired all the time and you hurt all the time and you're not sleeping, yes, you're going to become severely irritable. And so it's a very, very common later stage symptom that those with mold toxicity manifest. And then number 8, chronic sugar cravings. Remember that you can have mold in your home growing, you can have mold in your car growing, you can have mold in your office or workspace growing, but mold can also grow inside of you. It can grow inside of your intestines. Many people have mold exposure in their, mold growing inside of them, and that can actually contribute to severity of sugar cravings. So if you've got severe sugar cravings, you might want to consider mold toxicity as part of the reason why. Now, here's another big one, and that's nutritional supplement intolerance. Maybe you've been to multiple doctors, and many doctors have given you detox programs or giving you different nutritional supplementation, and no matter what you try to take, you seem to react in a very violent way or in a very aggressive way to the supplementation. You actually feel worse. This is a hallmark of mold toxicity. So if you're one of those people that are in that small percentage of people that react to supplements that are supposed to help you, definitely get with your doc and consider mold toxicity as maybe being a progenesis or a trigger in that regard. Now, some people also will lose visual contrast. There's some tests that you can do, some of them online. You can order them. They're called visual contrast tests. So if you lose your ability to see in contrast, that is also a symptom of mold toxicity. Vertigo and dizziness is very common in people being exposed to chronic mold. Brain fog and memory loss, severe emotional swings. Again, all of these part of the spectrum of different symptoms that can manifest with mold exposure. And I want to make a note here on mold versus mycotoxins, because many people get confused in this area because there's mold, and yes, you can be allergic to mold, but you can also be reacting to the mycotoxins that mold produces. Mycotoxins are they are very similar to VOCs. If you've ever heard of VOCs, VOC stands for volatile organic compound. It's the same kind of stuff that's emitted from paints, fresh new paints and other chemicals that are in common houses that many people that are super sensitive to chemicals react to. So mycotoxins kind of act like VOCs. So you can be allergic to mold, but you can also be reactive to mycotoxins. You can also have a non-allergic response or immune response to mold. And again, going back to part 1 of this series where I showed you research that showed that different people had IgG, IgA, and IgM responses to mold that was creating autoimmune neurological response. That's not an allergy. That's a non-allergic immune response. It's not the same thing. Remember, if you go to an allergist, they're generally going to do a skin prick test or an IgE test to tell you whether or not you're allergic to mold. But you may not have an IgE response. You may have an IgA, IgM, or IgG response. And again, not the same thing. You can also react to the mycotoxins themselves. Mycotoxins are highly poisonous substances to humans, and this is why we control the levels of mycotoxins in our food supply chain, because we know they can be very, very detrimental to human health. They've been linked to kidney damage, they've been linked to immune suppression, and they've been linked to cancer, among other illnesses and diseases. So again, just a side note on molds versus mycotoxins, because if you go to your doctor and they test you for mold reaction and you don't have discernible mold reaction, then the next type of testing that you should consider having done is a mycotoxin test. So again, very important to discriminate between the two, because both can cause damage, but they're not the same thing. But they're caused by the same thing, which is mold exposure. Okay, that's it for part 2. This is Dr. Osborne. Make sure you subscribe to the channel. Also like and hit the comments. We want to see what your experience has been with chronic mold exposure. So if you've had symptoms from mold, go ahead and chime in below. Tell us what they've been. And make sure up here to the right, hit that video, because part 3 is going to be just as good. We're going to talk about how to identify hidden mold. So we'll see you in the next video. Have a great day.